Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Trimipramine. Its brand name is Surmontil. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Trimipramine is an antidepressant agent that has additional anxiety-reducing sedative activity. In terms of indications for use, this medication is indicated to be used in the treatment of depression. Now, before somebody was to use Trimipramine, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication should not be used within 14 days of a monoamine oxidase inhibitor. If a patient had a hypersensitivity to dibenzazepines, they would not be able to use Trimipramine. And lastly, this medication cannot be used during the acute recovery phase following a myocardial infarction or a heart attack. In terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid giving this medication to the elderly population due to the syncope or fainting, as well as orthostatic hypotension, which is a sudden drop in blood pressure when going from a seated to a standing position, which may occur, because this can lead to falls, and in this population, falls can lead to fractures. Patients with cardiovascular disease should use this medication cautiously, as they may put themselves at an increased risk of experiencing a myocardial infarction or heart attack, as well as congestive heart failure. Patients may notice a blood sugar increase or decrease when using a tricyclic antidepressant. And patients with hyperthyroidism have to use this medication cautiously because they may be putting themselves at an increased risk of experiencing cardiovascular toxicity. Patients must use this medication cautiously if they have hepatic or liver impairment. This medication may lower the seizure threshold, so patients with a history of seizures must be cautious while using this medication. This medication may precipitate mixed or manic episodes in patients who have bipolar disorder, so patients should be screened for bipolar disorder before they use this medication. Patients with schizophrenia who use this medication may be putting themselves at an increased risk of experiencing psychosis. Patients with a history of urinary retention may experience a worsening of urinary retention due to the anticholinergic side effects associated with Trimipramine. And lastly, this medication should be discontinued if possible several days before an elective surgery. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Trimipramine, they can expect to receive their dose orally as it is available as a capsule. So if a patient is using this medication to treat depression and they're an outpatient, they would typically use 75 milligrams daily in the beginning. They would take this as 1 to 3 divided doses. They can then gradually increase the dose over a few days to 150 milligrams daily. The maximum dose in this setting would be 200 milligrams per day. For inpatients, they may start off with 100 milligrams per day, again given in divided doses, and gradually increase up to 200 milligrams per day. The maximum dose in this situation would be 250 or 300 milligrams daily. The usual maintenance dose is about 50 to 150 milligrams taken at bedtime, and this would usually continue for about 3 months. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Trimipramine, so I'll go over some of those here now. Some patients may experience hypotension or low blood pressure. Others may experience tachycardia or a rapid heart rate. Constipation and dry mouth are possibilities. Some patients may experience dizziness or somnolence and even blurred vision. Some more rare but serious side effects would be a myocardial infarction or heart attack, worsening of depression, and suicidal thoughts. That's all we're going to talk about today with Trimipramine. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.